Hello everyone and welcome to Master Dentistry with me. Here I am Dr. Diksha and I'm here to help you all during your final year exams. I'm going to provide you with all the required notes, so stay and bear with me. So today's topic is posterior palatal seal area, right? So, according to the definition by GPT, what is a posterior palatal seal area? Basically, posterior palatal seal area, it is an imaginary concept, right? According to definition, it is the soft tissue that lies at the junction of the hard and soft palate to which pressure within physiological limit can be applied by the denture to aid in denture retention. So, what does this definition tells you about? It is a junction, that is, it will meet two parts. So it is a junction, it is an imaginary concept between the soft and the hard palate, right? So a junction of the soft and the hard palate, to which when the denture will apply some pressure, in return this area will provide retention to our denture. Okay, this will provide retention to our denture. So the main concept of PPS is it provide retention to our denture. Okay, and one more thing, as the name suggests, posterior palatal seal area, that is, it will represent the posterior surface of the denture base. Now comes to the function of PPS, right? So, as I already told you, first thing first is retention. The first thing is your retention, that is, this area, the denture base in this area will always maintain a constant contact during functional moment, which will provide you with a retention also. Second thing, the second function is your, it will reduce tendency, it will reduce tendency to gag. This is the second function. Why? Because it will maintain a constant function, so it will prevent the entry of air also. So based on this, you can also tell about the third function, it will prevent the accumulation of food. And the last thing is compensation of polymerization shrinkage, right? Now let's talk about anatomy. So anatomically, PPS can be divided into two parts, right? The first part is pterygomaxillary seal, pterygomaxillary seal, and the other part is what is called the posterior palatal seal, right? So first I am gonna talk about the first thing I'm gonna talk about is the pterygomaxillary area. So pterygomaxillary area, just listen to me carefully and start writing your notes. They will help you a lot during your exam time. So the pterygomaxillary seal area. What is this area? See, it is that part of the PPS that extends, the part of the PPS that extend between the hamular notch, and anteriorly 2 to 3 mm on the mucogingival junction, right? Now you will ask me what is hamular notch and where it is present. So the hamular notch, I am writing it as HM. Sorry, hamular notch is present between the maxillary tuberosity and the hamular process of sphenoid bone. The hamular process of sphenoid bone, right? So, what is the importance? What is the importance of this pterygomaxillary seal? See, this area, it has three main characteristics. First, we have here is loose areolar tissue. Loose areolar tissue. Second, the area present here has very thin mucosa. It has very thin mucosa, and also it receives the fibers of which muscle? The tensor veli palatini muscle. So due to these weaknesses, these are nothing but weaknesses of this area, so we should never extend our denture beyond the hamular notch. Now I'm going to talk about the post palatal seal area. See, post palatal seal area, we have maxillary tuberosity. This is our maxilla. This is our maxillary tuberosity. So the area of the PPS that extend between one maxillary tuberosity to the other is what is called as the post palatal seal. Now, what is the importance of this post palatal seal? See, first thing, in the maxilla, we have pterygoid fovea, right? We have here pterygoid fovea. These pterygoid fovea are nothing. They are formed by the coalescence of the mucous salivary gland. So, the denture can extend 1 mm beyond it. But there is one more thing. If through these pterygoid fovea, if the draining saliva is very much thick, it is very ropey, so what will happen? We will never cover these pterygoid fovea because it will increase the hydrostatic pressure and it will displace the denture.